Hi, FreeBody Massage family. This is Kat here in Asheville, and you're about to see a full treatment for the scalenes muscles. This is so important. As you might have seen in the scalenes anatomy talk, which we'll put a link down in the description to that, the scalenes really hold tension a lot relative to stress, and who isn't stressed out in our modern lives. So it's good to have a good treatment plan specifically for the scalenes. And in this video, you're going to see me treat both sides. What you'll also see is that I begin by doing a little release in the pecs, the pectoral pull. We did release that video also. We'll put a link in the description of just that pec pull, which gives a bigger talk about why that's important. And the pec pull really is like the beginning of releasing the neck, because the pecs and lats and teres, but the pecs really draw the shoulders forward, which always creates some kind of like compression in the neck. A person is never going to be rotated forward and their neck be in good alignment. It's impossible. So just starting with that little pec pull, super important. And then you're going to see the scalenes fist glide, an incredible fascial release. Sometimes that's all you might have time to do, and it's going to have a really profound effect on the whole entirety of the neck. As well, you'll see specific trigger point release practices for releasing all three scalenes on both sides. And I want to say one more thing. You'll also see me demonstrate guiding my client through belly breathing, diaphragmatic breathing. Because again, like in the 3 key ways to help your clients relax, link will go in the description, those 3 keys, one of the keys is diaphragmatic breathing, because it sends that clear message to the nervous system that your client is safe and helps them to release. And when we can get them stepped back from that stress response, help them to feel safe, the scalenes will already begin to soften. So this practice puts together a bunch of pieces of FreeBody massage, trauma-informed trigger point therapy practices for you. I truly hope you enjoy this video. Have fun. So now we're going to put all those pieces together and show it in one flowing treatment for my client. So I'm going to begin with my client's knees bent and feet on the massage table with no bolster in the way. The bolster's removed. She's just laying on her back, and I'm going to guide her through diaphragmatic breathing. So Marie, bring your attention into your belly. Let your breath really expand your belly as you inhale. Perfect. And as you exhale, belly just sinks toward the earth. Your whole body sinking toward the earth. Great. And doing that again. Inhaling nice and big in the belly. Beautiful. Perfect. As you exhale, letting your body just be heavy to the earth, sinking to the earth. We're going to do that one more time. Inhaling big, the belly expands. And exhaling and sinking. And throughout the treatment today, I'm just going to keep reminding you to go back to that breath. So I just want to make sure that my client is able to breathe in her belly, because that's going to help the scalenes soften and all of her tissues to be more relaxed. So now I'm going to slide the bolster under her knees. And Marie, you can start to straighten your legs as I get this bolster in. Go ahead. Just get it set up. Does that feel like it's in the right place? Okay, great. So now I'm going to ask you, Marie, to put your hands on your belly, your elbows just a little bit wide. There you go. Okay. And I'm going to let this blanket, this area be a little soft, not pulled taut, so that I can get my fingertips underneath her armpits. And I always like to tell my client, and now I get to put my fingers in your armpits, okay? So Marie, as I'm about to do that, I'd like you to rise your breath up into your chest and just notice how that feels. Breath in the belly, up into the chest. Great. And then exhale, everything gets heavy. Perfect. Now I'm going to stick my fingers in your armpits right around that deodorant line, as I say. And then with my thumbs, I'm just kind of holding and grabbing her pecs. And then Marie, now you're going to start to breathe up into your chest, and I'm going to lean back and give a little pull. Notice my back stays straight. Exhale, let yourself get really heavy. I'm going to keep some pull on her pecs.
And again, inhaling nice and big up into your chest. I'm going to lean back a little bit more. And exhale. I'm going to give her back a little bit of slack, but I'm going to keep a nice pull. And last one. Inhale nice and big. And exhale. Great. And I'd like you to breathe up into your chest again. See if that feels any freer, any easier to breathe. Yeah? Okay, great. So just giving that little bit of release in the pecs, again, helps to soften the pull of the pectoralis major on the clavicles and helps all of the neck muscles to be a little freer and releases maybe some compression on the scalenes. So now we're going to go into the scalenes fist glide. And I'm going to stand up at the table so that I can use good posture for myself and take care of my body. Remember that anterior scalenes is deep to the sternocleidomastoid. And then middle scalenes is next, and the brachial plexus goes in between the two. And then posterior scalenes is here deep to the very anterior portion of the trapezius. So I'm going to make a soft fist, and I'm going to make sure that I lay the knuckle of my pinky right up against her clavicle, okay? And I'm making sure that I'm also not on her trachea, but right next to it. She's going to appreciate that I'm not on her trachea, okay? And then I'm going to stand up nice and straight, and I'm going to start slowly sinking in. All right, Marie, if you would slowly turn your head to the right. And I'm just dragging my fist very slowly down along the side of her neck. Pressure feel okay? Okay. It's not an incredibly deep pressure, but you can bring your head back to center. But it is enough pressure to kind of drag and free the scalenes up from their binding on the spine. So I'm going to sink in again. Okay, Marie, you can turn nice and slowly. Beautiful job. Pressure's okay? Great. Feels good? Great. And I go all the way down. Okay. And Marie, I'd like to do that one more time. Okay. And I'm going to anchor my pinky knuckle right next to the clavicle. And I'm kind of compressing through sternocleidomastoid and go right ahead. Dragging my knuckles across her scalenes as she turns her head to the right. Okay. Now let's just do a little bit of a test. Marie, you're going to come back to center. And I'd like you to turn your head to the right now. And then I'd like you to turn your head to the left. Can you feel the difference between the two sides? Yeah. A lot looser, a lot freer turning to the right now. Okay, great. You're going to bring your head back to center. I'm going to come to stand at the other side. I want to position myself well. My pinky knuckle is going to rest right next to her clavicle. And I'm going to sink next to the trachea. And go ahead. Please turn your head to the left nice and slowly. Yeah, very nice. Notice I don't use any oil. I want to have a fascial drag and freeing the fascial binding onto the spine. So I want to reduce that fascial binding. And if I have oil, I'm just going to be gliding over the skin. Okay? And we're going to do that 2 more times. I'm going to anchor in first and go ahead. And my pressure is just sinking straight down toward the earth, not pushing into the spine. And that's our number 2. Great. Back to center one more time. You're a pro already. Okay, and go ahead. Nice and slow. Slowly turning toward the opposite direction. My pressure down toward the table, toward the earth. Great. Okay, and then back to center. I'm going to come back to sit at my client. Take a nice big breath in your belly. Exhale, sink your whole body down to the earth. Okay, Maria, now turn your head both directions and let's see if you got a little more freedom. Great range of motion to the right. Much better range of motion to the left. Okay, great, wonderful. So we're going to start our trigger point treatment with some nice warming. So I'm going to put a little oil on my hands. And so you can see that I glide my thumbs under sternocleidomastoid so that I'm actually rubbing on the scalenes. I'm going to do a little bit of warming around middle scalenes, not a lot of pressure. Just using my knuckles. Getting down toward the bottom, toward posterior scalenes. I really like to give a few minutes of really good warming before working on these tissues. Remembering that stress activates trigger points in these muscles, and stress breathing activates trigger points in these muscles. And so we really want the nervous system to be as ready as it can be for the work ahead. And so now I'm going to notice I support her head with my arm. I'm going to show that again. I slide down, I support her head, and as I turn her head just rests beautifully right there on my opposite hand. And then I can do some nice gliding up on this side. Middle scalenes tend to be the most nervy of the three scalenes, the most nervy feeling. So I want to just be mindful. I don't want to dig my knuckles in too much and too deeply, especially when I'm just warming up the tissue. Just letting the nervous system get ready, increasing blood flow. And at the same time, I'm palpating and feeling the difference between the two sides. So I can feel that Marie has a bit more tension on the right side than she does on the left. And so what might that mean? That might mean that she tilts her head a little bit to the right more regularly. Did you nod? Did you do that? Mm-hmm. Okay. And then I'm going to bring her head back to center. Anterior scalenes right next to the trachea. Middle scalenes a little bit more lateral. Feeling those lines, feeling her middle scalenes are more tender or more tight. I want to follow and trace so that my thumbs even go deep to the collarbones here so that I'm tracing the whole length of the muscle. And then I can feel her upper traps. I want to soften those a little bit so that I can work deep to them when I'm working posterior scalenes. Okay. So now we're going to begin our trigger point treatment. Okay. I want to soften the scalenes just a little bit by tilting the head off to that side that I'm about to work on. Here is her sternocleidomastoid, right here. And if I have a little bit too much oil on my hands, I might just wipe some of that off. I could even use a face cradle cover or a pillowcase. I slide my fingers up underneath sternocleidomastoid and about halfway along sternocleidomastoid, I slide up. And then when I want to angle my fingertips, remember, I just lift my wrist. And usually right about here, I can feel the bony nubs of the anterior tubercles of the cervical spine. And right in the middle, often there's one that's a little bit more pronounced than the other. That's a common point for that anterior scalenes. I can bring it into one finger And as I lift my wrist, Marie, you're just going to let me know if you want more or less pressure. Is that a tender spot there? Not bad? Okay. So I'm just going to fish around a little bit. And you're going to let me know if I find something that's tender, okay? That one tender? Okay, great. And I want to make sure that I just keep a little tuck of her chin. I might give a little traction on the back of her skull to kind of keep her head tucked. If she's lifting her chin like that, then it's going to be harder for me because the muscles will be pulled into a stretch. So if I keep that, some clients have a hard time because of the tension perhaps in the pecs pulling everything forward, that when they get on the table, they'll be like this. So if I see that happening, I'm going to just take a little pillow to support underneath so I don't have to use my hands to do that. But Marie doesn't have that situation, so I'm going to slide back in. I'm going to find that little tender spot that I was just on. How about there, Marie? Am I back on it? So close, right? Mm-hmm. Right here. Okay. And then, Marie, I'm going to ask you to take a couple of breaths in your belly. Belly gets nice and big. Exhale, sinking down to the earth. Mm-hmm. Perfect. And again. And I just wait. And Marie, I'm going to ask you to let me know if at any time you want more or less pressure.
Give a little more.
A little bit more. So all I have to do is lift my wrist. That's going to drive my fingertips more into the tissue. How about that? Okay, great. And then the scalenes, remember, they get active in short, sharp breathing like a sniff. So Maria, I'm going to ask you to sniff really strongly a couple times. Mm-hmm. And do that again. Yeah, great. Mm-hmm. And then also the anterior scalenes tuck the chin. So I'm going to ask you to nod your head down and up. Mm-hmm. And down and up. A few more times. Right? Bringing more of the nervous system into play and trying to spread that tension into tone in the muscles. And is that getting any easier? Mm-hmm. Great. Okay, and you can relax. Wonderful. It's okay? A little tender?
Yeah, a little tender.
A little tender. Okay. So now I'm going to move a little laterally, and I'm going to slide my thumb under her collarbone, and I'm going to go side to side. So my thumb is just in there kind of going side to side, feeling the attachment area of the middle scalenes. I feel it's a little lumpy right there, yeah? Mm-hmm. So I feel there's a little tender spot right there. And how's that pressure? Would you like more or less?
I think that's good.
That's good. Okay. Does it feel a little nervy at all?
I just can feel it through to my arm.
Into your arm. Mm-hmm. Yeah, okay. And you're just going to sink here. Big belly breaths. Perfect. Exhale heavy. Mm-hmm. And again, nice big breath. Mm-hmm. Just letting me know if it starts to feel any better, any easier. Mm-hmm. It's just starting now, right? Mm-hmm. I can feel that tissue getting a little bit softer. It feels a little less lumpy under my thumb. Okay, great. Now I'm going to mindfully back off the pressure a little bit. I'm going to slide up the tissue. If I go side to side, I can feel the rope of that middle scalenes, and I can feel it's kind of thick right there also. And so I'm just going to angle my pressure diagonally into the tissue, following the curve of the tissue so that I'm 90 degrees. And how about there, Marie? Is that tender there a little bit? Mm-hmm. And let me know also if any of this feels a little nervy or if it feels referral into your chest or your arms or even your fingers. Okay. So if that's happening, I just would want to back off my pressure. I might even pull all the way out of the point, shift my angle slightly, and go in a little bit more slowly and a little bit more softly. Okay. So remembering that the scalenes tilt the ear toward the shoulder. So Marie, I'm going to ask you to just start to tilt your left ear toward your left shoulder. It's tilting your head. And then back. And you can see if she pushes her head into my arm, go ahead and do that again. Then you can feel that stronger engagement, right? And back off. Just do that a few more times. Tilt and back off. 2 more times. And last one. And how about that point now? Is that feeling any easier?
Yes.
A little bit? Okay, one more breath here. Nice big breath in the belly. Exhale, sink your whole body. Yeah, great. And then after we do several points, we always want to do a little soothing. Oh, that feels so much smoother. Can you feel that difference? That whole line of tissue is much smoother now. Great. And so I might follow it up. To me, it feels close to being clear, except maybe right there. Feel that. So what I'm feeling is it's a little thick and it doesn't, it wiggles instead of sinking under my fingertips. So I'm going straight medially toward the center of her spine. And how's that pressure feeling right now? Good pressure. Okay. If she told me it was a little too much, I would back all the way out, and then I would sink a little more slowly back into the spot, being mindful to use just a little bit less pressure. And then Marie, if you wouldn't mind tilting your head to the left again, and I can give her something to push against or not, it doesn't matter. If I give her something to push against, it's a little bit more strong of a contraction, but she's still engaging the muscle as she's tilting her head. Did it get a little exciting there for a moment? I saw your eyes open. Great. And you can relax and just do a little stroking up and down those middle scalenes all the way to their attachment. Does that whole line feel better to you now?
It does.
Okay, great. So now we've treated anterior scalenes just deep to the sternocleidomastoid, finding the anterior tubercles of the cervical spine and sinking straight down toward the earth. And then I went a little wider, skipping over the little valley that the brachial plexus lives in. I went deep under her collarbone toward the first rib and compressing down toward the first rib. And then I'm gliding up that tissue, angling my pressure, following it so that my pressure is always 90 degrees. Okay, and now we haven't treated posterior scalenes yet, but I'd just like to take a moment and ask Marie if she would turn her head to the right. How's that feel?
Feels good.
Super good, right? Okay. And then I'd like you to bring your head back to center, and then I want to slide your head over right ear toward the right shoulder. You feel that it's still stuck back here. And then how about this side? Feel the difference? Okay, great. So we're going to give that little bit of a tilt. And now I'm going to find the posterior scalenes by going deep underneath. So here's that upper trapezius, right? So I can just kind of squeeze the upper trapezius a little bit and angle my thumb toward the base of the cervical spine between C5 and C7. And as I go side to side, I feel a little muscle that likes to pretend it's a bone. It gets really hard and solid, yeah. And so I'm just going to angle in where I feel it's unforgiving. I kind of strum across it, and I can feel that tissue. Ooh, right there. Okay, yep, I'm glad we're here. And I'm going to just gently sink a little bit of pressure, angling 90 degrees. So remember that posterior scalenes is almost horizontal, just a little tiny dive, C5, 6, and 7 down to the second rib. And so my pressure is just in like this so that I'm 90 degrees to the tissue. And she's just going to breathe in her belly. Marie, you're going to let me know if that point starts to feel a little easier, a little bit better. Great job breathing. Good breathing.
Yeah, it's starting to feel better.
Starting to feel better. Yeah, I can feel getting a little softer, feeling less bone-like. Great. Great. So I'm going to slide down off that point. I'm going to follow that tissue as it dives still in front of that trapezius. And I can feel there's another hard spot right there. Yep. How's that pressure feeling?
It's good.
Yeah.
A
A little bit more. So I'm just going to sink my body forward a little bit. How about that?
Yeah.
Okay, great. Beautiful. Sometimes I think the hardest thing about this work is the patience it takes to let the points release. That's feeling better, huh?
It is.
Okay. Great. And then I want to do some soothing along that side. How's that feeling now as I'm gliding down? Scalenes,
It feels better.
Better. Can you feel the difference in those two sides now? How different they feel?
Yeah.
Yeah. Okay.
Much looser.
Much looser. Okay. So one more time, I'd like you to turn your head to the right, please. So good.
I could keep going.
A little sticky. Yep. And then we're going to slide your right ear towards your right shoulder. Okay. And then we're going to slide left ear toward the left shoulder. Sticky also. Yeah. Okay. Great. Wonderful. So a little soothing in between sides. Always like to do just some nice things. Everyone loves trapezius work, right? So I do a little bit in trapezius, doing stuff that feels good, in between the stuff that can be a little bit more intense. And then now we're going to go ahead and treat the other side. Okay, so second side. So I want to bring just a little lean of her head, tilt over toward the right, because I'm working on the right side. Here's her sternocleidomastoid right there, that one muscle that you can grab on the neck. I'm going to slide deep to that. I like to move my body toward the side I'm working a little bit. And then I lift my wrist, and that's going to start angling my pressure downward toward the table. And then I can use my flat thumb to palpate. I find the anterior tubercles of the cervical spine. And how about right there, Marie? Is there a little tenderness right there?
Yeah, right there.
Yeah, okay. And do you want more or less pressure?
A little more.
A little more. So all I have to do is lift my wrist and angle my thumb down a little bit more. How about that? Okay, great. And then take a nice breath in your belly. Exhale, sink. Relax your jaw. Yeah, great. And then a little nod of your head when you're ready. See if you can feel the tissue change a little bit as you're nodding. Like feel it kind of pull. Okay, great. Yeah, keep going with the nodding until it starts to feel better. And I can see before she even tells me that it's starting to feel better, because her motion, her range of motion gets bigger, right? And that tells me that she's feeling freer, that the tension is moving back more into tone in the muscle. Okay, and you can stop the movement. So that's that main trigger point right in anterior scalenes. And because this whole line for her is very taut, I'm going to go down a little bit further and check that lower portion. So see, I still have to stay deep to sternocleidomastoid. Okay. Next to the trachea, not on it. I can go down. There's often a little tender spot right here at the attachment. How about right there? Yeah? Okay. So I've isolated it with my middle finger, sliding in there. If I want more pressure, I lift my wrist. Is that okay? Yes. Okay, great. And because it's anterior scalenes, which tucks the chin, so again, that's going to be really common these days with people texting so much and looking down at small devices. So these muscles are chronically going to be short with people who look down a lot and look down at their phones. So Marie, could you do just a little nod? Yeah, there you go. 5, 4, 3, 2, 1. And how's that point feeling now? Is that feeling any better? Okay, great. And you can stop the movement. Great. And I'm going to slide. I don't want to slide and dig really hard. You know, I'm just kind of flat thumb over that because those anterior tubercles are very sensitive. Aren't you glad I'm not digging my thumb deeply in that line? Yep, she said thank you. Yeah, okay. So then now I come a little out to the side. My next line of muscle is middle scalenes, and I can follow it all the way down to just deep to the clavicle where it attaches and inserts on the first rib. So I want to kind of trap that attachment point right onto the rib. How's that feeling there?
Okay.
It's okay? Yeah. Okay. So I'm going to come up a little. I'm going to fish around a little bit. How about there? Is it a little more tender there? Yeah, okay. And we're going to keep your head just softly to the right. There you go. I can feel that if I go across that tissue, I feel that there's kind of a thickness there in the tissue. Does that angle feel good there? And just always let me know if you feel it in your arm. Scalenes can sometimes refer into the chest and even back along the vertebral border of the scapula. And then, Marie, I'm going to have you tilt your head to the right. So you press into my arm. There you go. And then back off. And then tilt. And more of an ear to the shoulder, less of a turn. Yeah, there you go. Yeah, feel that difference? Yeah. A lot of people will make that mistake. They'll want to turn their head instead of lean the head. And it's a very different engagement of the muscle. Yeah.
I feel that in my arm.
Feeling it down your arm, a little tingly in your hand. Just a few more times. And 3. And 2. And 1. And then relax your head for a moment. Let's check that tenderness of that point. Is that feeling any easier? Yeah. And then are you still feeling the tingly into your arm? Okay. So I just want to make sure that I'm not compressing the nerve. So I just move off it a little bit, come around onto the ropiness. I feel it's kind of like right there. Okay. So I'm going to sink in diagonally toward the spine. How about that spot right there? Okay. And does that feel a little nervy or a little tingly? Sometimes it takes a moment to kind of show up. Better. Okay, great. Let's just take a few nice deep breaths here in your belly. I'm just doing some soothing stuff with my left hand on the other side. I'm just going to let her breathe through this one. Feeling better? Yep. I got the signal. So I'm going to do a little soothing. Oh yeah, that feels better. I feel how it's less lumpy and chunky as I go down that line of tissue. Okay. And I want to just kind of follow up. So I'm almost directly medial on the cervical, along the cervical spine, following this line of middle scalenes. And then usually about halfway up, right there, there's usually a very tender spot. Okay. And we're going to keep your head tilted just a little bit to the right. There you go. Let your head get heavy into the table. And how's that pressure there? Is that pressure okay for you? And I'm going straight in toward the spine for this spot. Right around C3, C4 area. Direct pressure in toward the spine. Okay. And I just like to wait a little bit, let the tissue get used to my pressure. See if it's going to start releasing on its own without any movement. Is it starting to feel any better? Yeah? Okay. Couple more breaths here. Letting your shoulders be heavy, letting your head be heavy. Nice, beautiful. Back of the body heavy to the earth. Great. And I feel like there's a little bit more in this line of tension right up here. Is that a tender spot for you?
Yes.
Okay. I'm going to hold that spot again and just check my own posture. So what I did was I scooted up just a little bit. I'm right below C2. So right near the attachment at C2. And I'm going to drive my pressure straight in toward the spine. Does that pressure feel okay? Mm-hmm. Do you want more or less? Good. Okay. I always like to say more or less and not just is that good, because good could mean it's great, there's no tenderness, or good can feel like, oh yeah, that's a good spot, right? So I want to just make sure that the pressure feels right for the tension. It feels like it's already releasing to me. You feeling that? Mm-hmm. So I just felt the tissue get a little softer, a little easier under my fingertips, and then we're going to take a little break. And glide down the tissue. Notice I can stroke my thumbs all the way down so that they go deep to the collarbone there. Great. I'm going to bring myself back so I'm centered right behind her head again. And then I always like to let my clients feel how their body is changing as I'm doing the work, step by step. So for this, Marie, I'm going to ask you now to turn your head to the left and see how that feels. We haven't released posterior scalenes. That looks better, huh? Okay, back to center. And then let's do a little tilt. Great. And how does that feel?
Much better.
Much better, okay. I want to caution you, there's something that is a little bit of a pet peeve of mine with people doing neck work, is that what I've seen people do is tilt the head. I'm not going to do it to you, Marie, but I'm going to demo what it would look like. And they push the head this way and push the shoulder this way. That is not helpful. I have never found that to be helpful because full range of motion is really about 65 to 75 degrees. We're not meant to be able to literally look behind our shoulders with our heads. So please don't do that turn and then push and push because you actually can do some damage to the spine there. So we're going to not do that. And then I'm going to soften up right here at the trapezius. And then I squeeze that upper trapezius, and then I know my thumb is resting. My hand is a little heavy toward the earth. Now my thumb is resting right where I want it to go. So Marie, I'm going to ask you to scoot that shoulder down just a little bit so folks can see. Yeah, there we go. I'm going to bring your head over a little bit this way. So I can feel, if I strum along there, I can feel that there is a line of muscle that goes diagonally just like that. That is posterior scalenes. So I'm going to angle toward the lower spine. Ooh, right there. I feel that it's like a hard little boniness, but it's not a bone. It's posterior scalenes. So I'm going to compress toward, almost toward, kind of my pressure is diagonal because that's the angle of the muscle where I'm pressing. So 90 degrees to the tissue. Do you want more or less pressure?
I like that pressure.
You like this pressure. Okay, great. Mm-hmm. Are you feeling any referral anywhere?
My scapula in my back.
Mm-hmm. Feeling it around her shoulder blade, exactly. Mm-hmm. Yeah. And letting your body be heavy. There it goes, a little bit softer, a little tiny bit softer. Can you feel that releasing a little, getting a little sweeter? Okay, so I feel like that. I don't want to beat the points to death, right? I just want to kind of help the tissue to soften. And I'm going to slide down, following along that tissue. And my next spot right here, I feel, yeah, I see her squint a little bit, so I'm not going to do that any deeper. And I'm going to angle straight in, kind of toward the center of her body. In toward the rib. And how's that pressure? Does that feel right? Yes. Okay. And Marie, you could tilt your head into my arm. There you go. And away. And tilt. There you go. Feel that difference as it engages when you tilt. Yeah. Great. And again, tilt. Yeah. A few more times. 3. 2. Better? And 1. Great. All right. Could you bring that left hand back up for me, please, just for a little bit? Okay. So now I'm going to check. Oh, yeah. So much smoother, huh? Okay. I'd love for you to take a nice big breath into your chest. Great. Breathe in your belly. Great. And then our final check. If you could turn your head both directions. Ah, so much freer. Great. Beautiful. And then I'd like to do a glide. So we're going to tilt the left ear toward the left shoulder. Freer, yeah? And tilt the right ear toward the right shoulder. Great. And then I'm just going to do some smoothing, some soothing of this tissue. Great. And so that is the whole treatment of the scalenes, anterior, middle, and posterior scalenes.